The basic physiotherapy principle I learned from my university is if it's weak, make it strong. If it's tight, stretch it. But is it always true? In this video, I'll show you how to relieve your tight lower back without stretching your lower back. Hi, Yuji Kitano here from Kitano Method. I'm a physiotherapist and trainer to celebrities and professional athletes and Paralympic athletes from Japan. I help you eliminate your pain and get you moving and live the life you always wanted, both online and on-site. If you're new here, make sure you click the subscribe button. And if you're seeing the value in this video, make sure you're giving it a thumbs up. It really makes a huge difference. Let's get into it. I still remember one of my physio school teachers told me, if you treat the area that is hurting and it gets better, you don't need a 4-year degree. I didn't actually learn that in 4 years, but now I figured it out myself. And that's the Kitano Method. We think differently, efficiently and effectively. Now, here is how to relieve tight lower back without stretching your lower back. If you have watched my last video, you know why you get the tight lower back. If you haven't, please check it out from the link above. Yes, it's the tight abs. It's simple. We need to somehow loosen up your tight abs and stop them from pulling your body forward. But you might be thinking, but my abs are pretty soft, look. I'm not talking about how it looks. It's about the tone of the muscle. It's overactivated. It's all happening under your adipose tissue, aka fat. If you poke the overactivated muscle with your finger, it's quite painful. For example, if you make your biceps tight like this and then poke it, it hurts. But if you relax it, it doesn't hurt. So when you poke your abs and it hurts, even if you think you relaxed, it's overactivated. This continues to pull your body forward, and that's why your lower back is tight. Interesting is that even your abdominal muscles are tight, you don't feel it, like your lower back does. I suppose your tight lower back is telling you that, help, someone is pulling me forward. Can you please tell them to stop it? So let's tell your abs to stop pulling your body forward. The best way is to give a good old massage to your abs. Just lie down and poke your abs with your fingers. These are the areas that you should work on. The solar plexus, along the bottom of the ribs, and along the belly button. To find the area that is tight or painful to push, then work on it gently for about 5 minutes. If you have a foam roller, you can use it as well. It's more effective, but it can be quite painful and uncomfortable. And avoid doing this after a big meal. And here is how you foam roll your abs. Now, this is how you foam roll your abdominal muscles. Okay? You put the foam roller on the floor and put your abs right on top of the foam roller. And get on your elbows and toes, just roll up and down between your bottom of the rib cage and top of your pelvis. Here's a special guest of the day, Andrew, the skeleton. May I? Okay. Okay, we're gonna stick this foam roller between the bottom rib cage to the top of the pelvis. We're gonna put the foam roller here and you're gonna roll. Is that okay? That hurts a little bit, but it's all good. Good. All right. And then second one is foam roll your obliques. It's between your rib cage and your top of the pelvis. It's a very small gap here. So there's a little gap between your bottom of the rib and then also the pelvis here. Okay, and then we're going to stick this foam roller right on this gap. Very small, but you can still roll it. Okay, and then you can roll the oblique muscles. Okay, what we're going to do, lie on your side and put this small gap on top of the foam roller. Elbows down, put your foot down, then roll up and down. Okay, like that. About 10 times. Good. After that, what we're gonna do, instead of rolling the foam roller, we're gonna roll. We're going to roll. Put your foot in front of you. Okay, just roll back and forward. Like this. Can be quite painful. It's about 5 times. Okay, good. Okay, let's do the other side too. So put the foam roller down, lie on your side, put the foam roller a bit in the gap, leg straight, right foot down, and just roll it up and down. About 10 times. Good. And then put this foot on top, front of it, and just roll back and forward. Good. Okay, and this is how you foam roll your abdominal muscles. Now, after this, you should feel so much relief on your lower back. Try to sit up straight. It's so much easier to sit up straight without hurting your lower back. Then slowly stand up. You should feel lighter and taller. Just enjoy the moment for a while. And this is how you're supposed to be. And you might be asking, but how long is it going to last for? That's a good question. I'm glad you asked. Unfortunately, the tightness will come back sooner or later. Even with the Kitano method, the years of bad habits cannot be fixed in 5 minutes permanently. But you found the true cause of your tight lower back and fix it by yourself without hurting your lower back, without stretching or getting massages. And the more you practice it, your body will learn the way your body is supposed to be. Just spend 5 minutes rolling your abs every day. It's super simple, but very effective. And if you're a runner and suffering from the tight lower back while running, try this as a part of your warm-up. Your lower back should feel so much better compared to just foam rolling your lower back. So, please write about your experience in the comment below. I'm looking forward to hearing how you're going, because I got your back. Thank you, Andrew. Yeah.